Guys, and welcome back to my YouTube channel. My name is Nkiruka. If you are seeing this place for the very first time, you are welcome, and if you're a returning subscriber, thank you so much for tuning in today. So in today's video, we have a guest on this channel. This is the first time we're having a guest on this channel. He's an amazing person. He is an amazing tutor, and he's a medical doctor, and he's also my husband. So he's going to be taking us on today's topic, which is the different vaginal discharges and what they signify and their causes as well. So, but before we get into the video, let me allow him to introduce himself first. So introduce yourself to my audience.
Hi guys, I'm Dr. Mike. I'm glad to be here.
Okay, thank you so much for being here. We are glad to have you around. So like I said, you'll be taking us on the topic that says different vaginal discharges, their causes and what they signify. So I have some questions I've already written down for this video. So I'm going to be asking you the questions while you respond to the questions. Okay?
Okay.
All right. The first question is, what is vaginal discharge?
Okay, vaginal discharge are secretions produced by glands in the cervix and the vagina. Okay, ideally they track down. They normally come out of the vaginal orifice, and they can be around the introitus, the vulva area.
So you are trying to say that those discharges are produced by glands?
Yes.
And they are tracked down into the vaginal openings, right?
Yes.
Okay, so when we see this, we'll now see it as vaginal discharge.
Yes.
Okay. So the second question is every vaginal discharge normal? We see vaginal discharges on our pants, and on different occasions people complain about discharge. So is every vaginal discharge we see on our pants or we see on our vaginal orifice normal?
Not all vaginal discharge are normal, and not all vaginal discharge are abnormal. So the answer is no.
Okay, so you're trying to say that we have normal vaginal discharge and we have abnormal vaginal discharge. Okay, so that being said, the next question is, what is normal vaginal discharge? How do they look like and their characteristics?
Normal vaginal discharge, also called physiological vaginal discharge,
okay,
is vaginal discharge that is clear, is odorless, is colorless, and is non-irritating. A kind of vaginal discharge that does not actually stain the pants, okay, or the underwears. Now, these are produced by glands that lines the cervix, the vagina, and in some occasions, glands that are located in the vestibule. Okay, and there are some periods in a reproductive age woman's life that this normal vaginal discharge is increased. Okay, conditions like pregnancy, conditions like menstruation, during menstruation, especially during the premenstrual period. Okay, then ovulation, when a woman is ovulating, the vaginal discharge will be increased in amount. And then a woman that is taking contraceptive pills will have increased vaginal discharge too. Okay, so in a nutshell, vaginal discharge, a normal vaginal discharge, is clear, odorless, non-irritating, does not really stain pants, and it does not come with other symptoms like itching, hurting, pain around the vulva area, okay, and so on.
So you are trying to tell us that normal vaginal discharge is clear, and it is odorless, and it doesn't irritate, it doesn't cause any form of irritation, right?
Yeah.
Okay. And also you said there are some situations where the normal vaginal discharges can be increased. like during ovulation, in pregnancy, and when a woman is using a contraceptive, right?
Yes.
So it can be increased. So in such situations, there are still normal vaginal discharge. So the next question is, what is abnormal vaginal discharge?
Abnormal vaginal discharge is also seen as a pathological vaginal discharge.
So pathological meaning
abnormal,
okay,
diseased condition
okay,
that causes the vaginal discharge. Okay, so it is a kind of vaginal discharge that is excessive. It's excessive in quantity, produces offensive or malodorous smell, and then it has a kind of color. Could be yellowish to greenish gray to mucopurulent, discharge. Now these are because of infective or non-infective processes in the body, especially in the reproductive tract of the woman. Okay, and when this happens, infections from fungus, bacteria, which could be sexually transmitted or non-sexually transmitted, and this predisposes the patient and the woman to having this vaginal discharge, which is said to be abnormal. Looking at, because of the context of what we are discussing in today's video, when you see a discharge that is thick, whitish and cuddy, okay, a thick, cuddy, whitish discharge, which is non-offensive, it is odorless actually, but is associated with a lot of symptoms like itching around the vulva area, soreness, place is feeling hot, pains, because of scratches that the woman, had to respond to the itching. And this is basically caused by what is called vulval candidiasis. Okay, this is a fungal infection of the vulva as well as the vagina. Okay, so that produces that kind of vaginal discharge. Vaginal candidiasis. The discharge is thick, cuddy, and whitish discharge. Okay.
And it comes with itching.
It comes with itching.
Okay.
It comes with soreness.
Okay.
And then, if the woman attempts to have an intercourse, there is what is called superficial dyspareunia. At trying to the husband trying to enter into the woman, there will be a still resistance, pain, but once the man is inside, there will be no pain. The pain goes down. Okay. So now there's another type of vaginal discharge that looks grayish white in color. Okay, this one is grayish white in color. It's very, very offensive. It smells very well, and it has this characteristic smell, a characteristic fishy smell. Smells like fish oil. Okay, and is thin, is homogeneous. It's not really like it's mixed with a lot of things. So it's uniform in consistency. Now this kind of vaginal discharge is seen in bacterial vaginosis, when there is excessive bacterial multiplication in the vaginal canal. Okay, and once you see this, it means the patient has bacterial vaginosis. Okay, and should seek for medical attention, as fast as possible. Okay, There's another type of vaginal discharge that the color is yellowish gray. Some say yellowish green in color. Okay, and then this type of vaginal discharge is always frothy. It looks like it's foamy. Okay, and then it's profuse. It's excessive. Yes, it's in excess, and this is seen when somebody has trichomoniasis. When someone has trichomoniasis, okay, it's a bacterial infection. Actually, it's sexually transmitted. Okay, so then there are other associated symptoms, not just the vaginal discharge. Okay, then lastly, there is another type of vaginal discharge that is referred to mucopurulent vaginal discharge. This one looks like pus. It looks like pus. Okay, and is always due to sexually transmitted infections, and the causative organism, the type of conditions where you can see this mucopurulent vaginal discharge is where you have something like gonorrhea, chlamydial infections, PID, that is pelvic inflammatory diseases. Okay, so in this kind of conditions, the discharge does not look classically white or grayish white or gray, yellowish green or yellowish gray. It looks like pus, and it tracks down, and it's very, very offensive. Very, very offensive too. Okay, and then once a woman sees this, we should seek for medical attention as fast as possible. Okay.
So that's the abnormal discharges that a lady can see. Okay, so you've made her to understand that when abnormal discharges is not something we should play with. Any lady that sees an abnormal discharge from what he has explained to us now in this video should, go to the hospital, see the doctor, and get it treated as fast as possible or as early as possible, because it has a lot of complications which even have something to do with our fertility, which is very, very important. Okay, so if you have any question for this video, you can leave your questions in the comment section. Our doctor will be on the comment section to answer all your questions. Okay, so thank you so much, Dr. Mike, for being here with us. I enjoyed this topic. I really enjoyed it. I learned a lot of things, and I really learned a lot of things, and I hope you learned something as well. So thank you so much, guys, for watching, and comment, like, share with your friends, and do not forget to subscribe to this channel and turn on subscribe to the channel for more videos like this, because we'll be coming up with more interesting videos and interesting topics like this. And do not forget to turn on the post notification bell to get notified each time I upload new videos like this. So thank you so much, guys, for watching, and I'll see you in my next video. Bye.